Malaysia's top health official has admitted that the government may have loosened COVID-19 lockdown restrictions too early. Health Director General Dr. Noor Hisham Abdullah was referring to the movement control order in January. He said that it did help prevent the number of daily cases from climbing, but it failed to bring figures down to double or triple digits. New daily infections have been hovering at around 4,000, with 3,973 new cases today. Dr. Noor Hisham acknowledged concerns about the impact of the latest lockdown, but he believes that the government must act as a third wave of infections could trigger a national crisis. Malaysia will enter a nationwide lockdown tomorrow to control a spike in infections. Melissa Goh with this report.
Malaysians are simply tired, with no end in sight to the pandemic more than 1 year on. And this food delivery rider response says it all.
It's national lockdown.
You know what? I don't even bother to know what's happening. As long as I know I'm safe.
It's the third nationwide lockdown since last year, and many fear that it won't be the last. Now scheduled to go on till at least the first week of June, Malaysians are told to stay home as much as possible as authorities battle to slow down the spread that's projected to hit 5,000 daily cases by month end. Now, although most business sectors are allowed to operate, including the eateries and restaurants, but for takeouts and delivery strictly, only 30% of management staff are allowed into the office, and most are told to work from home. Now, the popular Ramadan bazaars that were operating till here last week were told to close after they were listed as potential hotspots. Now, for many, it was a loss of their livelihood.
Mayas tu, MCO pun main dulu. Orang pun kerja pun itu habis kurang, orang habis pun tak mari.
Traffic is a bit lighter in and around Kuala Lumpur. Only 3 are allowed per car. Interstate and inter-district travel is still banned, not just for the Eid festival, but for the entire month.
Tak boleh balik kampung, semua tutup rumah juga.
Health Director General Dr. Noor Hisham, who re-emerged in news conference after more than 2 months, sought public cooperation to flatten the curve in order for the healthcare system, he said, to rebuild buffers. Now, hospital beds, including those in intensive care units, are almost reaching its full capacity. The new variants, he said, have proven to be a lot harder to treat.
Sekarang ni dengan varian baru, jangkitan di usia yang muda semakin meningkat dan juga gejala semakin teruk, dan ramai dimasukkan ke hospital dan juga di ICU, dan juga rentan ataupun tak berkesan dengan rawatan-rawatan yang kita berikan. Contohnya kalau kita menggunakan steroid.
Malaysia has reported more than 60 South African variant cases and 2 involving the Indian variant. It's stopping all social gatherings in a bid to prevent further community spread. Melissa Goh, CNA, Kuala Lumpur.